Ophthalmia neonatorum, also called as neonatal conjunctivitis. It is bilateral inflammation of conjunctiva occurring in an infant. Etiology. Source and mode of infection. The infection can occur before birth, during birth, or after birth. Before birth, it occurs due to infected amniotic fluid in mothers with ruptured membranes. During birth, during the vaginal delivery, from the infected birth canal, the infection can occur. After birth, the infection may occur during the first bath of the newborn or from fingers soiled with infected lochia. The incubation period, we can know the causative agent depending upon the incubation period. If it is 6 hours, the cause is chemical, that is due to silver nitrate. If the incubation period is 1 to 2 days, cause is gonococcal. 3 to 5 days, the cause is other bacterial infections like Staph aureus, Streptococcus pneumoniae or Haemophilus species infection. 5 to 7 days, herpes simplex type 2. If it is greater than 1 week, the cause is chlamydia, D2K serovars. Coming to the clinical features, they include pain and tenderness in the eyeball, conjunctival discharge. It can be purulent like in cases of gonococcal, or it can be mucopurulent in cases of chlamydial infection. If it is in the infective cases, the lids are swollen. In HSV infection, we can see eyelids and periocular vesicles may occur. Conjunctiva, it may show hyperemia and chemosis, and mild papillary response may be present, but the follicular response is typically absent. Corneal involvement is rare. It may occur in the form of SPK, superficial punctate keratitis, especially in herpes simplex, ophthalmia neonatorum. Complications. If the cases are untreated, it will develop into corneal ulceration, which will perforate, heal. There may be opacification. So, corneal opacification and staphyloma formation are the complications. Coming to the treatment of ophthalmia neonatorum. First, before starting the treatment, what we'll take is conjunctival cytology samples and culture sensitivity swabs. How we are going to treat? Based on the cause. So, if the cause is chemical, then no treatment is required because it is self-limiting condition. If it is gonococcal, then we have the topical therapy and systemic therapy. In the topical therapy, we'll give saline lavage hourly till the discharge is eliminated. Then we also give bacitracin eye ointment 4 times daily. In cases of proved penicillin susceptibility, we can also give penicillin drops 5,000 to 10,000 units per ml should be instilled till the infection is controlled. If the cornea involvement is present, then we go for the atropine sulfate ointment. Systemic therapy will give ceftriaxone 75 to 100 mg per kg per day, IM or IV 4 times for a period of 7 days. Then if the cause is bacterial, then we go for antibiotics broad spectrum for 2 weeks. What we can give is neomycin or bacitracin or tobramycin. If the cause is chlamydial, that is neonatal inclusion conjunctivitis, we'll give topical tetracycline 1% or erythromycin 0.5%. Eye ointment 4 times daily for 3 weeks. And we also give azithromycin suspension 20 mg per kg, single dose is given. And here when cause is chlamydial, both the parents should be treated with systemic erythromycin. Then coming to the herpes simplex infection, it is a viral infection, so we give topical antiviral drugs to control the infection and prevent the recurrence as well. What we give is high dose IV acyclovir is given in suspected cases of systemic herpes infection. Coming to the last part, that is prophylaxis. We have the antenatal, natal and postnatal measures. Before birth, what we are going to do? We are going to take proper care of the mother, treat the genital infections when suspected, and during the 3rd trimester, all the women have to be in the surveillance for which infections? 3 infections, chlamydial, herpetic and gonococcal infections, and we have to go for the surveillance. Suspected case is treated, then prevention is successful. Coming to the natal measures, delivery should be conducted under aseptic conditions. Newborns' eyelids have to be cleansed properly. Postnatal, within the 1 hour of birth, what we'll give is 1% tetracycline or 0.5% erythromycin ointment should be applied. This will successfully prevent the ophthalmia neonatorum.